This Apollo Trinity Medical Center is a tie-up between Apollo Hospitals Enterprise Limited and Trinity Healthcare, Shillong. So it's a collaboration between Apollo and Trinity to bring this OPD medical center in Shillong. We have the state-of-the-art OPD medical center in Shillong, where specialists from various Apollo centers across India, the doctors, will be coming and doing the consultation here. Apart from that, we have lot of separate preventive health packages as part of the Apollo group, which is the standard Apollo health packages across. We have for the children, for the women, for the senior citizens, for youth, for regular health checkups, preventive health checkups. Part of this, we have end-to-end diagnostic and the lab services here. In the second phase, we are starting with our dialysis, endoscopy, CT, and MRI. So it's a comprehensive one-stop shop for diagnostic services, end-to-end diagnostic services that will be providing from Apollo Group here. We also have local consultants who will be sitting with us for including medicine, gynae, pediatrician, cardiology, oncology. We'll have doctors from here. Apart from that, as I mentioned before, time to time, senior specialists from all over India, Apollo centers, will be coming and doing consultations here. The various departments that we have is, first of all, the cardio section we have, where you have ECG, TMT, and echo. We have the PFT, the ultrasound, the X-ray, dental, opthal, even the physio unit is here. And we have our integrated lab. So, and our lab is also tied up with Apollo Diagnostics. So, in fact, for the reports and everything that we'll be getting, these are standard Apollo formats report. Plus, also we are launching the patient's app. So, for example, you can book your appointments, you can book your home collection, you can check your reports. All reports will be available at your app, and these reports can be valid wherever you go, anywhere. You can just show them the reports; they will understand these are Apollo standard templates report. So you don't have to carry bulky files with you. All your medical diagnostic reports will be present in your app. Even the doctors will have their own app where doctors will know how many patients are lined up, and we want to do this is basically we want to give you a specific slot, specific timing where you can just come, show your consultation and go. In the sense, instead of wasting the whole day in the facility. So basically, as I said, this has been done with Apollo Pro Health, which part of the Pro Health is basically we have to go for all the kind of checkups on be it physio, be it dental, be it optical, be it your whole body diagnostics. You can come for individual test also. You can come for a package also, depending upon what the patient's requirement is. See, what we have done is we have got the latest up-to-date machines, right? Plus our technicians, what we have taken are also have been they have done their orientation training at Apollo, right? And all our reports that will be generating from here will be a second level check will be done by Apollo. So they standardized and a quality reporting is given to the patients. So what we want to do is, if I talk about healthcare, health is one aspect of it where we give all the kind of support in terms of equipments, technicians, and things, and the caring part is secondary. So we are more concerned about the caring part. So patient to be taken care, patient to be given the proper reporting, proper service by us, so that they get the value for the money they spend at the hospital. Patient friendly things what we have is the unit is we have something called patient care executives. Okay, so their job is that once the patient comes to the center, handhold the patient till the patient goes out of the center, because patient should not get lost. Patient anyway, the patient when they come is they are already disturbed with the medical thing. So what best we can provide is kind of support services where a person will be there assisted them for all patients. It's not only for corporate or this, any patient will be coming, they'll be guided by our patient care executives. And secondly, they said when the patient goes, even the reports, as I said, will be available on their app. They can come and collect the reports. And for senior citizens, what we are doing is we are going one step further. Is if the senior citizens wants us to collect the sample from home, That's normal, I think everybody does. What we are going to do is one step is even the reports will deliver at home, so that they don't need to travel up and down, coming up and down like this. As part of the health package, when the patient come for a health package, as I said, they will complete the entire activity within 2 hours or all the health checks. Followed by, once the report gets the reports, there is a consultation by our MD medicine, internal medicine. He will be doing the consultation, and then, if at his wisdom, if he thinks that he has to be specialized thing, then he can contact the specialist. See, as of now, this is the first step. We are starting with the OPD medical service. Our second project is obviously within 1.5 to 2 years, we want to start the Apollo Super Specialty Hospital here. Right. But as of now, also, we are building up the telemedicine center here. So, for example, if you want to contact or consult any top specialist of Apollo Chennai or any Apollo facilities, right? It's just a click away. We will connect the patient through here to the Apollo, and they can do the entire consultations here. All his reports will be available at Apollo. They will check the reports and then do the consultation. So a lot of patients, especially for critical thing, they want to go for a second opinion. So they can take a second opinion directly from the super specialty specialist from Chennai, Hyderabad, Delhi, Kolkata, even for Guwahati. So our referral center is Guwahati, and our regional center will be Kolkata. So, and beyond Kolkata, we are actually landing up to Chennai. So we are setting up the telemedicine where at least people does not have to travel to Chennai for a consultation. They can do the consultation sitting here. Our pricings, basically, these are standard Apollo pricings. Obviously, it will be market friendly. Every locations has their market dynamics. So obviously, I can assure you, people will get value for the money. Number two is we are just starting. We are launching we have started the OPD services now, but we are launching, formal launches on 19th of February. Post that, once we'll run for 2-3 months, the entire process, and the process gets smoothened up. Then obviously we'll be tying up with MHIS or CGHS for that matter. But as of now, first 3 months actually we need to strengthen the system and the processes. Otherwise suddenly you get a volume of patients and you are not able to cater to them as per your standards. So we have been advised by Apollo also that first 3 months let us start operations, smoothen the operation before we go for the types. What we can tell you is the kind of processes and the systems that we have placed into the facility, and the kind of doctors right now presently also who are sitting with us. If anybody is looking for a consultation with a super specialty doctor, like today also we had Dr. Abdul Bashish, is a super specialty of Ops and Gynae from Chennai. 22nd we are having a super specialty Dr. Jagdish is coming from Chennai. So they are super specialty doctor. So if anybody wants to get a super specialty consultations, plus if they want to get proper reporting, value for money, and the support services that will extend, we are not competing with anybody else. We're just basically trying to live up to the standards what Apollo gives. Basically, you will understand, anybody who is connected with Apollo, the facility they get in Apollo Chennai, they'll expect the same facility to be given here. So we are trying to live up to that, and I can assure you that patients will be coming with us. Proper care will be taken so that they get their reports on time, the consultation on time, and as I said, with the telemedicine facility and with super consultant visits, they can have the second opinion, which many centers might not have.
Nara chugumak ansing baljokna skama mabanggi jasan.
Chugumak tanam?
Enda ko de kuros kama tungo maina chugumak kuni jainga. Plus F markadong pa ko.
Plus F?
Salantio anchini chaani rango. Peena namgani rangko de bangakon watchanga. Jayan anchini bimang. Gisik. Porayani. Nambate rakani. Mandapani. Aro gemuk konik nikata. Nang koban.
Ndak plianga chaunan machungja?
Oe chugumak nanganirang unigaman na atta merong kari to aru dutrang ho koros kaingon plus F marka dongpa ko sa nibo maina uno iron aru vitamin rang ko nangani kriotna sungi chane chaoba mukron chinioba aru chathoanioba mamang dengtangani ko ijawa
Dentang rekan ku ijo ramai nasa brans ka injok.
Ndiba mengsau blongen dengtang rekani donga anchingyan seng baljokaniyo Nambata chaani rengani chi, nambate jangi thangani. Plus F marka dongpa chaani rangko, daaloni jakhalbo,